Dr. Friend, we enjoyed your 1-minute conversation about sinusitis. Is that how you say it? Sinusitis? I've had it and didn't know how to say it. Is this pretty common? Do a lot of people here in the South, especially with the allergens we deal with in the air, is this a pretty common thing that people deal with?
Very common, especially during the spring and early summer months. It's probably the second or third most common complaint in a primary care doctor's office.
And as you said in your presentation a moment ago, rarely do you need to attack it with antibiotics. In fact, not only would you normally not do that, that can only make the problem worse. Is that right? Or could?
Correct. Well, antibiotics are very much overused in this country, and they can actually cause resistance to the bacteria, and so it can harm you for when you do have a bacterial infection. We may not have an antibiotic to fix that problem, which can cause real problems.
Now, this isn't something to be taken lightly. This is more than just a runny nose. People really feel bad when they're going through the worst parts of this, correct? What are the general symptoms? I know runny nose, but you can get a headache and a sore throat.
So even the worst sinusitis infections are rarely bacterial. Those that are associated with fever and facial pain and thick green drainage from your nose, sometimes those don't even need antibiotics. It's really need to see your physician, particularly if you're having a lengthy episode that lasts more than 14 days, or if you have a chronic medical illness like diabetes or on chemotherapy or some other immunosuppressant medication that could cause the infection to get worse.
Years ago, when I would call my doctor with a stuffed up head and a runny nose, one of the first questions he would ask was, is your drainage clear or not? And often he would say, well, I'm going to prescribe an antibiotic. I'm sure he, at the time, thought he was doing the best thing. But the color of the drainage isn't necessarily the final decision-making thing that you put into the formula, correct?
Correct. Viruses can cause green drainage. Allergies can cause green drainage. So there's a lot of things that go into that decision-making process of whether or not you should get antibiotics. And certainly you should not expect to get antibiotics when you go into your physician for a routine sinusitis.
What's the problem with taking antibiotics when you really shouldn't? If you take antibiotics 3 or 4 times a year, what kind of problems could that cause?
Well, they can cause some life-threatening infections in and of themselves. They can cause Clostridium difficile, which is a horrible intestinal infection. They can also cause resistance to the common bacteria, which you get on a routine basis. They also have other side effects, heart arrhythmias, nausea, vomiting, diarrhea we've already mentioned. So it's really something you want to avoid and only take as a last resort if prescribed by your physician.
So you got my attention when you said it could cause life-threatening issues. That's a very serious thing not to take lightly. So I come to you with bad drainage, no matter the color, and I ask you to help me. You mentioned it briefly in the earlier statement. What would you generally expect to tell me to do to get better?
So what I tell my patients is to get some warm saline or salt water, and that's something you can mix at home. Boil hot water and mix it with a couple tablespoons of salt, let it cool off, and irrigate your nasal passages with that vigorously 3 or 4 times a day. That's going to take care of most of your symptoms and acts as an antibacterial wash as well. And then if we decide to add a nasal steroid, that'll help decrease inflammation and actually has been shown to help resolve some of these symptoms more quickly.
Do you find some patients have a little bit of a difficulty irrigating their nose? I do. I get choked. I try too hard. I probably put too much saline into my nose. Give us some good do's and don'ts basics on that.
So there's some very common over-the-counter saline irrigation formulations available. Any of the generics available, those work very well and are all sterile, and we know that they're not contaminated. So I recommend that you use those right off the bat.
I've heard people use, I never have, a Neti pot where they use a lot of water and pour it in one side and it comes out the other. I don't think I could ever do that. Do you find that any more advantageous than just a small bubble thing that you squeeze the water in?
Actually the most helpful are the easiest to use, and that would be the over-the-counter mixtures of normal saline that are available at any drugstore.
If you follow the guidance you've given us today and it seems to persist and you just can't seem to shake it, then you probably do need to get in and see your doctor and follow his guidance.
Correct. That's the best thing to do, but give it some time. And usually this resolves within 7 to 14 days. And it's just miserable to deal with. And there are some other symptomatic treatments that you can try, decongestant perhaps, which helps thin the mucus and helps it drain. You really want to avoid an antihistamine unless it's allergic, because the antihistamine makes the mucus thick, sticky, and actually can clog your sinuses up.
Thank you for your time, your expertise. We appreciate it. Dr. Richard Friend, thank you.
Thank you.